So today I'm going to be talking a little bit about Medicare reform and what's going on with it right now. Currently, Medicare is basically a broken system that has many benefits and disadvantages to the US on a national level, as well as many benefits and disadvantages to people on a personal level. So talking about the people that are recipients of Medicare and have some plan with them, it benefits them, but also it does not seem like a sustainable way of making healthcare for the country. Medicare is meant to aid those who may not be able to help themselves in certain ways, especially with healthcare and prescription and other things like that. However, there are problems with the current policy. It is beneficial to some people, however, it could be much better in helping them achieve what they need to have the best health. So, talking about how it's a broken system. It is a broken system, and the US continues to use this broken system because it is extremely profitable and powerful for the private healthcare industry. For example, when somebody goes and they need a private healthcare insurance, or they use Medicare to go to the doctor to see them, the doctor, the private healthcare industry of the doctor is benefiting from the use of Medicare. And Medicare for all which is what Bernie Sanders has been discussing recently. It just makes too much sense, and it's not profitable for private industry, so it is highly unlikely that it's going to come into play. And it'll benefit the people too much, and it would take away the benefit from private industries and private companies. So it's not as profitable as it would be for them. So it's unfair for the people, but it's good for these companies, and large companies run healthcare, so nobody would really benefit from it. This broken system also plays on people's fear of change, the truth behind what is actually going on and being caused at a national level, and other important facts are being withheld from the public. So if people really knew how much this was costing us, how much it was costing people on national debt, I highly doubt that they would want to continue with something that isn't sustainable and that wouldn't be able to help their children and for generations to come. There is an enormously high spending that the US is spending on healthcare. The United States spends about 3.2 trillion healthcare yearly, with that being at almost $10,000 a person. That is highly unsustainable, and that's not going to be able to benefit people in the future to come, and it's just not going to last. So Medicare for all is definitely a good idea, in my opinion. So benefits. Americans express much less satisfaction with healthcare when compared to other countries because we do not have any kind of free Medicare, any free healthcare, any healthcare that's really benefiting everybody on a national level and benefiting the government itself too. National debt can potentially go down if if we change a lot of policies within Medicare, and with the new policies that are going to be put in place, then potentially we can get out of that billions and trillions of dollars of debt and deficit. There'll be better healthcare for people because more people will have access to better healthcare. And Medicare for all is not a new idea, though it may seem like a new idea. Sanders is just bringing it back up, and more people will benefit from it and have all around better healthcare. So healthcare definitely needs to be reformed. Some disadvantages: it can cause higher premiums for more well-off beneficiaries, yet it would still cut costs for less fortunate recipients. So some people would have to pay more, but it's within their means, so it wouldn't be too much of a problem. Drug prices for long-term illnesses can end up being higher, for example, cancer drugs. However, other basic medications that people need on a daily basis, but not life-threatening diseases, could potentially be lower. But so there is some give and take in Medicare reform. And dropping the independent advisory board could end up adding billions to national deficit, even though that is only potentially a part of the reform. However, and also Medicare for all could end up being costly. Sanders was talking about that, and he even said himself in one of his recent interviews that Medicare for all would be useful to the people, to the citizens and the recipients. However, it may not be the best thing for the government on a national level. So I am in place. I stand by Medicare reform, and I feel that there really should be changes in the Medicare policy as far as the payment plan and the premiums that are being paid by the beneficiaries, the financial security. I don't see it being sustainable for a long periods of time, for a longer period of time, without us going into more and more debt that we won't be able to dig ourselves out of. It would be a lower cost to certain beneficiaries. However, the more well-off ones would have to pay a little bit more, but that wouldn't really it's a little give to take, but everyone would be a little happier with it. It would be a lot easier for a lot of people. And I do see it being more sustainable if we make the changes that are necessary, because if the youth can't benefit, if the youth who ends up being the elderly can't benefit from Medicare, then there's no point to it. So I really think that we should save healthcare with Medicare reform. Thank you.